Welcome to the Workplace Minute, powered by H3 HR Advisors and sponsored by Paychex, one of the leading providers of HR, payroll, retirement, and software solutions for businesses of all sizes. My name is Steve Boese. Long COVID is keeping many younger workers out of the workforce. Millions of Americans, mostly younger adults, could be unable to work due to lingering symptoms of long COVID, a new study says. Researchers found that about 14% of working age people with long COVID symptoms hadn't returned to their jobs within 3 months of their initial infection. When we compare the rates observed in this study to the national population, it could mean as many as 2 million people may be out of work because of post-COVID conditions, said lead researcher Dr. Arjun Venkatesh, chair of emergency medicine at the Yale School of Medicine. Worse, the average age of those affected was roughly 40 years old, Venkatesh added. This has big economic impacts, he said. It also has impacts on those people individually in terms of their own income security and their ability to care for themselves and their families. Results also show that the most stricken by long COVID are more likely to be unable to work. The study focused on long-term data gathered on more than 6,000 COVID-19 patients at 8 study sites in Illinois, Connecticut, Washington, Pennsylvania, Texas, and California. Among the nearly 3,000 participants who were employed prior to the pandemic, almost 10% reported having 5 or more symptoms of long COVID months after their initial infection, according to the research. This number was important because we've shown in previous studies that the number of symptoms someone has after being infected with SARS-CoV-2 may be more indicative of how severe their long COVID is, Venkatesh said. And those with 5 or more symptoms were more than twice as likely not to return to work than COVID patients with no long-term symptoms, the results showed. These findings, which were published recently in the journal PLOS One, suggest that people with long COVID might need the same sort of economic relief and support that was provided to people during the pandemic, the report argues. Given the millions of people who've had COVID in the United States and the millions of people that report prolonged symptoms, this is not a small problem, the researchers note, so it does require big interventions. In the findings of the study, the researchers noted that despite the end of the federal public health emergency for COVID-19 and the efforts to return to normal, policymakers must consider the clinical and economic implications of the COVID-19 pandemic on people's employment status and work absenteeism, particularly as data characterizing the numerous health and well-being impacts of long COVID continue to emerge. Improved understanding of risk factors for lost work time may guide efforts to support people in returning to work. While COVID is in the rear view mirror for most of us, it is important to remember the many thousands of citizens and workers who are still feeling the negative impacts of this awful pandemic. We will continue to follow all the important topics and trends in the world of work here on the HR Happy Hour Media Network. That's it for the Workplace Minute, powered by H3 HR Advisors.